Have you ever looked at a public health issue and thought, the solution seems so obvious, why hasn't anyone done anything about it? Well, today, we're going to pry open what's known as the policy black box to find out. We're going to explore the hidden forces that actually shape the rules that affect all of our lives. So let's get right into it.
All right, to get us started, here's a real head-scratcher. Back in the early 1980s, research clearly showed that putting infants to sleep on their backs could dramatically slash the rates of sudden infant death syndrome. I mean, a simple, free, life-saving piece of advice. And yet, in so many countries, it took years, sometimes more than a decade, for this to become official policy. So what was the holdup?
You know, the delay had nothing to do with the science. The evidence was rock solid. It was about everything that happens after the science is settled. It was about power, about process, and yeah, about politics. So today, we're going to open up this so-called black box and see how the decisions that impact our health are really made.
To really get what's going on inside that box, we've got to start by meeting the cast of characters. These are the players, or actors, who are trying to influence the whole process. And trust me, it's a much bigger group than just the government officials you might be picturing.
Okay, so a huge piece of this puzzle is interest groups, and they usually fall into two big camps. On one side, you have your sectional groups, so think professional associations, like for doctors, or big industry groups, like for pharmaceutical companies. Their main goal? To protect the interests, usually financial or professional, of their members. And they often have a lot of money and direct access to policymakers to do it. Then, on the other side, you have cause groups. These are your advocates, your activists, groups pushing for a specific cause, like environmentalism or public health. Their power doesn't come from deep pockets, but from getting the public fired up and grabbing media attention.
But, and this is where it gets really interesting, those lines can get super blurry. The source material highlights this fascinating tactic. Sometimes, those industry groups will actually fund patient advocacy groups. Why would they do that? Well, think about it. A message about how great a new drug is sounds a lot more genuine coming from a patient who uses it than from the company trying to sell it, right? It's a really complex part of this whole power game. And the list of players just keeps going. You've got massive corporations that not only have tons of money, but can actually sue governments over policies they don't like. Then there are the professional lobbyists, whose whole job is to get in the room with decision makers and bend their ear. But hey, power isn't just about cash. Researchers and think tanks have the power of expertise and data. The media can completely shape the public conversation, and never underestimate the power of civil society. Organized movements of regular citizens can create pressure that politicians just can't afford to ignore.
Now here's a key thing to remember. These players aren't just operating in some kind of vacuum. They are all on a specific playing field, and the nature of that field, what we call context, can pretty much decide who wins and who loses before the game even gets started. So what exactly is context? Well, it's basically the whole backdrop. It's the political system of a country, the current state of the economy, the dominant social and cultural values that people hold. Context is the reason why a policy that works wonders in one country might be a total disaster in another, even if they're trying to solve the exact same problem.
And we can break that context down into two main types. On one hand, you have situational factors. Think of these as sudden, often dramatic events. A natural disaster, a huge media scandal, maybe a new leader gets elected. They can suddenly create a window of opportunity for change. Then you have structural factors. These are the deep-rooted, slow-to-change things, like a country's form of government, its economic system, and its long-standing cultural norms. These are the bedrock. And context can absolutely make or break a policy. The source material gives this really powerful historical example. Back in 19th century India, British colonial rulers tried to implement health policies. But these policies were based entirely on British cultural views and prejudices. They completely ignored the local Indian culture. And guess what? They were a massive failure. The structural context, that local culture, was just way stronger than the policy. Okay, so we've got the players and we've got the playing field. Now let's talk about the actual rules of the game, the policy process itself. This is where we can really see how and when power gets used to shape what happens next. You know, if you open up a textbook, the policy process looks so neat and tidy. It's usually shown as a simple cycle like this. First, a problem gets recognized and put on the agenda. Then, people come up with solutions. After that, the chosen policy gets implemented. And finally, you check to see if it worked. Seems logical? Pretty straightforward, right? Well, here's the catch. That very first step, agenda setting, is arguably the most important battleground of them all. Before anyone can even debate solutions, someone, somewhere has to decide which problems are even worth paying attention to. I mean, out of all the issues in the entire world, why are politicians focused on these specific ones and not those? The answer, in a word, is power. So a political scientist named John Kingdon came up with a more realistic model. He said that for any issue to really get on the agenda, 3 separate streams have to all come together at just the right moment. You need the problem stream. That's when people suddenly recognize something as a serious problem. You need the policy stream. That's when you have good, workable solutions ready to go. And you need the politics stream. That's when the political will is actually there to get something done. When those 3 streams meet, bam, a window of opportunity opens up.
And this brings us to what might be the most critical insight about power. A lot of the time, the greatest power isn't about winning a big, noisy debate. It's about exercising power silently, by making sure certain topics never even come up for discussion in the first place. I mean, think about how many decades it took for smoking bans to get on the agenda. For years, powerful interests were able to keep it framed as an issue of personal choice, not public health. And that completely shut down the debate before it could even begin.
So, let's put all these pieces together, the players, the context, and the process, and see how it works in the real world. There's a case study from the source material that just perfectly shows this black box in action.
Back in 1994, the Indian government passed a law to tackle a really serious problem. The use of ultrasound for sex-selective abortions was creating a dangerously skewed gender ratio, with way fewer girls being born than boys. The policy had a clear and, I think we can all agree, noble goal, but by almost every measure, it has largely failed. So, why?
First off, let's look at the players. The source explains that many of the very people on the ground, we're talking doctors, private clinics, and even families, actively work together to get around the law. The network of players who were supposed to be implementing the policy were actually undermining it.
Second, the context. That law ran headfirst into a massive structural factor, a deep, culturally rooted preference for male children in many parts of the country. That cultural context created so much social pressure that it proved to be way stronger than the words written in the law.
And finally, you have the process itself, which was just weak. The source points out that implementation was poor, enforcement was almost non-existent, and there were very few consequences for actually breaking the law. So you see, a policy is just a piece of paper if the process to actually make it real isn't there. The players, the context, and the process all worked against it.
So, we've taken a peek inside that black box, and it's pretty clear it's not some simple, logical machine. It's a messy, dynamic arena of powerful players, complex context, and political process. Understanding these forces, really getting how they work, is the absolute first step. It's how you go from being just a spectator to someone who can actually influence the decisions that shape our health and our world. So the real question is, now that you know, what are you going to do with that understanding?